Welcome to the weekly checkup on ReachMD, your source for the latest in medical education, breaking news, and various editorial topics. This week in medical news, a new study published in JAMA Pediatrics found that babies delivered via C-section were 15% more likely to become obese in childhood and 64% more likely to struggle with weight compared to siblings born vaginally. The analysis included 16 years worth of data for more than 22,000 young adults. Based on the new findings of heightened obesity risk, researchers urged expectant mothers to consider this and other factors before undergoing elective C-sections. For continuing updates on this and similar women's health stories, visit reachmd.com/news. If you haven't heard, ReachMD is now offering a sexual health awareness playlist for the month of September. Here to explain this educational offering further is Dr. Jennifer Caudle.
Hello, I'm Dr. Jennifer Caudle, host of Everyday Family Medicine on ReachMD and on-air health correspondent. I'm here to share a new playlist from ReachMD in recognition of Sexual Health Awareness Month. Learn about various topics related to sexual health, such as patient counseling strategies, STI prevention, physical and psychosocial barriers, and much more. Registered users can listen by heading to reachmd.com/sexualhealth or by downloading the ReachMD app.
After learning about how to improve your patient's sexual health, switch gears to health policy and get the latest breakdown on the Affordable Care Act in practice as we discuss its successes, failures, and future on this week's episode of Voices from American Medicine. Finally, check out this episode of Speaking Of to learn some quick tips on phone etiquette for physicians. If you think you know how you sound to patients over the phone, Karen Friedman's here to provide a wake-up call.
You've probably been talking on the phone for as long as you can remember. So why do you need to watch this video about phone etiquette? Because most of us have never heard how we sound on the other end of the phone. A couple of tips for you, beginning with don't rush. Too often, professionals return calls at the end of the day, and that's a time where many of us are trying to wrap up and get out of that office. So inadvertently, we speak too quickly. We all do it. Try taking a breath and pause to slow it down, as well as allow the other person to ask questions. Number 2, be careful not to cut people off. Even though you're calling to give someone results or perhaps advice, they will likely have questions. If you talk over them, it sounds like you're not really interested in their concerns. Finally, patients tend to judge the warmth and efficiency of a practice by the way people answer the phone. So imagine if you walked into a store and someone started barking at you. You would probably not want to go back anytime soon. Consider training your staff, like the quality of care you work so hard to provide, quality of service, and the way that service is communicated often keeps patients coming back. For ReachMD, I'm Karen Friedman.
You can watch the rest of this series by visiting reachmd.com, downloading our mobile app, or streaming on any one of our available platforms. On behalf of everyone at ReachMD, thank you for joining us today. I'm Sherry Neely, as always, inviting you to be part of the knowledge.